Okay, this is Stacy
and Lucinda Rowe.
And Lucinda from the Colorado Cross Disability Coalition, and we thank you for joining us. We are discussing the importance of Medicaid, which we know that most of you out there are experts in this. You definitely know your Medicaid is vital for your funding. But Colorado Cross Disability Coalition is doing a whole project on positive messaging for Medicaid. We believe that it's so vital for so many Coloradans, and a lot of people don't realize that or don't have a positive view of Medicaid. So we're reaching out. We'd like to get 250-plus organizations to agree to send out positive messaging for Medicaid, and Lucinda always has the count. What's our count?
120 as of today.
120. So we're getting there. We're getting there. We want to reach 1.4 million people on the value of Medicaid. What we found out by doing some surveying is people really appreciate what Medicaid does for children. They appreciate keeping people with disabilities in the community and alive, and they appreciate what it does for seniors, but the word Medicaid seems to be a turnoff. So we're looking to develop messaging that will help people be more positive about it and realize its vital importance to the community. And our messaging, we'll repeat this, should be coming out the first week of October. So we'll be getting back to everybody with what the messages are then. So why are we doing this? We're a population who Medicaid can be life or death. It's been really clear over the last couple of years that many members of the public support Medicaid but don't really understand it. So it's an important part of the economy, which you know, especially in rural Colorado. We want to spread the word and get everyone on the same page about the importance of Medicaid. So we explained about the polling data that it's almost the word that kind of turns people off itself, and they don't realize how many people it's supporting with and without disability. So we're helping to explain to everyone what Medicaid does, reach out to those who benefit it, both directly and indirectly, and then tie the importance of Medicaid to voting. So at the same time, we're doing voting projects as well. Hence, it's not just positive messaging, but hashtag vote for Medicaid. We want people to educate candidates for office, especially state office. And at CCDC, we had a forum with Jared Polis where he answered questions about Medicaid and health care. And we've talked to his running mate as well, Diane Primavera, and she knows a lot about the importance of Medicaid. And we are still trying, if anybody knows, to get in contact with the Republican candidates. They didn't want to do a forum, so we're hoping that they'll have a meeting with us as well, because we want to educate everyone. Our goal is that no statewide candidate for any office or any party will work to destroy Medicaid as we know it. So we are a 501c3, so we can't do anything partisan and can't spend a certain amount of money lobbying without appropriate reporting. So this project is run by a nonprofit. We're getting nonprofits as well as for-profit agencies and hospitals to help us. So that we're hoping to be vetted by both. Our mission is to advocate for social justice for people with all types of disabilities. It's the only organization in Colorado advocating for disability rights. We call it cross-disability because it's everyone. We have people of all types of disability, from Down syndrome to cerebral palsy, spina bifida, people with autism, with brain injuries. We have people who may be deaf or blind, people with autoimmune disorders, and CCDC both works for and with people with disabilities. So our staff are people with disabilities or have disability in their family. We know those with disabilities have a lot to offer us. So we're always looking for volunteers at the end. We'll show you how to become a member, which is free, and we want to involve as many people across Colorado as possible. Our motto is nothing about us without us, ever. We ensure physical structures are compliant with policies and procedures and decrease barriers. So So we do systemic advocacy as well as advocacy one-on-one for people who call in. We've helped make Red Rock more accessible, and we've worked on housing issues as well. But we want to make sure that people know this isn't a disability thing only, that it's definitely for everyone. The concept of universal design applies to many things, not just architecture. Many people use Medicaid throughout Colorado. So, for instance, I was able to keep insurance. I have an autoimmune, so when I couldn't work, I could keep looking for work and remain healthy. That was a big deal for me. It was definitely vital.
And we're also helping with the voting registration.
Thanks.
So these are just a few people from our team that work closely on the Medicaid project. So we have Julie Riskin, which is our executive director, also professor and advocate. Dawn Howard is our community organizer and supervisor. She's also an advanced advocate and a woman that lives with slight CP. Me, Lucinda Rowe, I'm also a community organizer as well as a parent CNA. I've been with PASCO for the last 14 years, caring for my daughter full-time as well as advocating for her needs. She is 21, living with severe CP. Stacy Yusim is a community organizer, advocate, and woman living also with a slight disability. So #Vote for Medicaid, a public education project. We want to educate the community about the importance of Medicaid and to send out positive messaging. Here I am speaking on behalf of the HCBS waiver last summer in front of Senator Gardner's office. We all were trying to save Medicaid from being cut and capped. And just to be more personal from this slide, I have my daughter as well as my two sons and my grandfather, which also was a civil rights activist here in Colorado for the Chicano movement in the 1970s. He was the vice chairman for the Crusade for Justice, Juan Haro. So civil rights is very big with my family, and as well as I want to make sure that my daughter is treated equally, and that's why this is very important to my family.
This is a graph we have on Medicaid spending that you probably well know, but sometimes it surprises people. The spending is significantly greater for seniors and individuals with disabilities. And this is because the long-term care services that Medicaid provides, not any other insurance doesn't provide it. Medicare does not provide this. So a lot of seniors will be on both Medicare and Medicaid if they need 24/7 support. So those cost more money, they keep people alive, and they keep people in community settings. We have a timeline for our project. So you know, CCDC opened its doors in 1990, so we've been fighting for justice for people with disabilities for quite a while now. In 2017, you're probably aware that there were a lot of rallies to protest potential Medicaid cuts. That was one of the ones that Lucinda was telling you about that she was at. So CCDC was instrumental in working with other groups, Atlantis and ADAPT, to be in those rallies. There was people without disabilities, too, that really wanted to keep Medicaid. In May, we started this outreach for Vote for Medicaid. And in June, Julie Riskin, our executive director, has been doing the whole summer listening tours to find out what's going on with people with disabilities across Colorado. And one of the things she's found is that we knew that accessible housing could definitely be an issue, but there's a lot of substandard housing out there, which also affects people's health. So I think we're going to be doing more housing issues at CCDC because of that. In July, we had 80 organizations signed on, and now we have 100, and I've already forgotten this, 120. So we're still growing. We still want organizations to sign on. We feel the more positive messaging out there, the better. It'll make a big difference. We had a candidate forum just last week, and we have our ADA Access Awards coming up on October 3rd. Thank you. I always say 2nd, on October 3rd. So if you have any questions about that, please let us know. And then we'll be doing this through election and hope to continue through the rest of the year on positive messaging. So this is pretty much how it works. We're reaching out to all kinds of organizations. We've got hospitals. And Lucinda, can you name a couple of the places that we have that...
So right now we have Children's Hospital is one of the biggest ones. They're a nonprofit here in Colorado. We're still waiting on UC Health, but they should be signing on either this week or next week. They just had to confirm it with their board. We have Parent to Parent, PASCO Home Health.
We're talking to Colorado Access. They seem very interested to sign on, as well as the Alliance. Yeah. So that made a big difference. That larger organizations that people look to are signing on. We feel that's important. So what we'll ask you to do when you sign up, we want to be able to use your organization name, and that's going to be important, so we can let them know that you signed on to this project. And give us an approximate number of people you represent, could be clients, could be members, and use our social media messaging as much as possible. So this could mean repeating and liking tweets, liking the project on Facebook, and we'll be asking in early October that you disseminate at least one message to your stakeholders that explains it's important for people to vote to support Medicaid. So that messaging will be coming out. And in talking to groups, we realized that a lot of times they are doing messaging. They already have the platform, and they're just using it to talk about Medicaid in a way that really resonates with the people that they're working with. So it's going to stay nonpartisan. We're still trying to invite more candidates to speak with us so we can get that message out. The steering committee is putting together, they're from a number of different organizations, is putting together the messaging, and will be, our public goal is to have a diverse steering committee. We feel that it is, and the organizations that have signed on have had input into questions and things that were asked at the forum. So it gives you kind of another venue to make sure the things that are important to your organization get out there. There's no money. We're not asking people to support us with funding. We may ask if you have resources to help support a candidate forum or another part of the project, and people have been great, like the Alliance giving us this webinar to do that. But we're definitely interested in having you sign on, and we want to hear from you as well and what's important to you and what you think we could do best. Okay, so this is just a short slide on seniors. We think it's important that they often need additional support to remain in their home. Even seniors with Medicare, and you may already know this, will have to have Medicaid if they are in a nursing facility with more medical needs. And that also this is really important to family members that care for people, that they can actually care for their senior in the home and be paid for their support services. So that's a big deal as the population ages. We have a lot more seniors that need care. Keeping them in the community is one of our first priorities. Okay, and this you will know really well. In fact, you may be able to add some points here that we don't have, but we let people know because a lot of times they think of the individuals getting services, but that medical facilities really rely on Medicaid. So a lot of the hospitals in rural Colorado couldn't exist without it, and the people that contract with them and supply, as well as the urban and specialty rehab hospitals that are in the Denver metro area. And we also have all the medical professionals treating people, and we've just listed to let people know that it's not just physicians, but it's people who provide the important auxiliary services like the physician's assistants, people who do dental health and pharmacists, an occupation, physical, and speech therapist, and then we were talking about the home health aides. So there's a huge group of people where Medicaid makes a big impact.
So also on this slide, we wanted to make sure that you knew that students benefit a great deal from Medicaid. So students receiving medical care from their school health clinics. Health clinics are a very big support for individuals in the school setting because some parents won't or are not able to take their children to certain appointments, so they're able to see a nurse on site, or if they scrape their leg, or if an individual needed specialized G-tube feeding, or they needed coaching, like some of the paraprofessionals needed staffing or coaching to help with an individual with special needs in the school setting, the nurse would be able to take care of them. Right now, there's 102 nurses throughout the metro and Colorado area, and that is a big thank you to one of the organizations that are also signed on, and it is called
the Consortium.
The Consortium. Kim Erickson is the executive director, and she was kind enough to come or to let us speak with her about the project also, and she let us know that 102 nurses as of this year are on location in the school districts. Another example for students is getting supplies at the school through Medicaid. So, for instance, my daughter wanted to be out on the playground with her peers, and there was no accessible swings for her, so I was able to help the school get an accessible swing so my daughter can be out with her peers playing during recess. Mental health, there's mental health providers that are able to assist with needs in the school through Medicaid. Vision and hearing clinics are a very big Medicaid recipient for school districts. They have vans that come and go and travel throughout the school districts to make sure that kiddos that, are having a hard time in class might be misbehaving, but actually they probably are diagnosed with not being able to see the chalkboard or the whiteboard. And this helps parents realize that the kiddo needs glasses. So that's a big thing for Medicaid also. We also have the anti-bullying and suicide prevention that is funded for Medicaid. And that is a really big cause for our school districts also that we need to be aware of. Ange, our IT and teacher for our advocacy class, is also a suicide prevention sponsor and coach, and she informed us that suicide is really getting much worse right now, especially in Colorado, and it's ages 10 to 24 years old for our adolescents. Medicaid also helps graduate school students, and they are able to get Medicaid for their families also. So it's just a very big issue with schools and making sure that our schools have the funding for Medicaid, because without it, our students wouldn't be able to thrive and get the proper education that they need. So vote for Medicaid. The client on Medicaid thrives and grows as a better student. The disabled adult on Medicaid is able to stay in their home and in the community, and the senior adult is able to get proper care in the home or in the nursing home setting. So the biggest thing is quality of life. We want to make sure that all individuals and able-bodied people have a quality of life here in Colorado. So is this connected to the universal health care or Medicare for all? No, this is not. It's just about Medicaid. While some of us might like Medicaid for all, other of us do not think this is the way to go. This is about preserving the Medicaid and that we have right now. And then you may ask, what about all the problems with Medicaid? It couldn't be more efficient, or of course it could be more efficient, but destroying the parts that work will not make it more efficient. There are many groups and efforts that work to improve Medicaid in various ways, and many of the people involved in this project participate in those groups. And this project, however, is about supporting the value that Medicaid brings to Coloradans. So why now? Medicaid was signed into law alongside with Medicare in 1965, but we're still here today in 2018 trying to make sure that Medicaid does not go away. Without Medicaid, people will die, and I personally would not want to institutionalize my little girl. She will remain in my home for the rest of her life, and that's where I'd like to keep her, and we just want to make sure that individuals like my daughter are able to stay within their communities and with their families. So #Vote for Medicaid, a public education project. Private insurance does not pay to keep people thriving within their communities. Medicaid does. Medicaid provides the long-term care that individuals need to stay within their homes and with their families. So Medicaid is so important right now, more than ever. And we just like to ask you to join CCDC and help so many others that need it. Nothing about us without us ever. This slide is for questions, so maybe we can unmute it right now and see if anybody might have any questions about our project.
All calls are unmuted. Any questions for the presenters today?
Okay. We wanted to talk a little bit about collecting stories as well. There are several groups. One is working to help people become more expert, to be advocates for Medicaid, and you can call CCDC to find out about that. We're also trying to look for more stories. It's vitally important that people tell stories about Medicaid. A lot of times, until they really need it, people don't really think about it. They think about it as kind of an entitlement program. Oh, if you're not working or don't want to work, you may have to get Medicaid. And that's definitely not true. So we're trying to make it easily understandable by your average person who may not know anyone on Medicaid, which I doubt, but they may not know that they know anyone on Medicaid, or they have never been on themselves. So we're looking for stories of how it's important, stories like Lucinda about her daughter. One of the people we work with, our supervisor, does Medicaid buy-in, and we wanted to bring that up for everyone. When we go out to outreaches, a lot of people haven't heard of Medicaid buy-in, and it's made a huge difference for people at CCDC. So people that maybe couldn't be paid because of restrictions on having Medicaid and making any money. Our executive director is one who worked for decades for CCDC without being able to get a paycheck because she'd lose her health benefits. Now she can get a paycheck, buy into Medicaid at a really reasonable amount, and continue working. Those of you who are in nonprofit know that they don't tend to pay a lot, but being able to work at something you love, make a difference for your community, and keep your health care and keep yourself healthy is huge. So we're also talking about Medicaid buy-in for people, which we think is important.
And Medicaid buy-in also helps people finally come out of poverty. A lot of individuals were living in poverty without the Medicaid buy-in, and now we just want to make sure that we are sending out positive messaging for that also, because our numbers need to come up on that.
So one of the next steps in becoming part of our project is we can send you a link, and we'd like to do that for a lot of organizations. I think Josh has already sent out the link. It's just a short form to say that you pledge to put out positive messaging for Medicaid. And we welcome people. It may be that you want to sign on, but you decide later, well, maybe we're going to do our own thing. That's fine. It's not like a do-or-die contract, but we think that people will want to continue positive messaging. And it may be that we feel, especially talking to you today, who know so much about Medicaid, it's integral to the work you do, that you may be able to help us really refine our advocacy to groups as well. So we'd appreciate any comments you have as well. That will help us do a great job of getting this word out.
We just want to thank you for your time and thank the Alliance as well as Josh and all his team here and giving us their support and letting us host this webinar today. Our information is on this slide. Lucinda Rowe, I can be reached at 303-994-0313, and my email is alrowe@ccdconline.org.
And then Stacy Yusim, you can reach me. This is my cell phone, so 312-206-7763, and it's SYUSIM@ccdconline.org. We also want you to please visit our website. You can see more about what we do and more about the project at www.ccdconline.org. And you can also find out about our membership, which is free. Julie sends out, and the rest of the staff sends out updates about any laws or regulations that may affect people with disabilities. And we try to keep up with what's going on, particularly in Colorado, but also if something's coming up nationally. And we'll tell you about rallies and any kind of event where you can support people with disabilities.
And ADAPT will also be live here in Colorado on November 12th.
If you're interested, and we have more information on that. Are there any more questions or comments that anyone has?
Well, Lucinda and Stacy, on behalf of Alliance, we thank you for coming over today. We will make this webinar available on our website under training opportunities. We'll also send it out to all the IDD providers in the state as well as our membership. So stay tuned to get the YouTube link, but thank you again for coming over.
Thank you.
Thanks so much, Josh.